This is communication 1105 speech 3, persuasive speech. Here are 6 people to watch me give the speech. I am now going to hand over the camcorder.
Thank you, Mitch.
So what I'm going to be talking to you about today is knowing where your healthcare provider gets their supplies from and how it can heavily impact your hospital or doctor's experience and possibly save your family's life. It is inevitable that everyone will go to a healthcare provider in their life, obviously. Healthcare provider, I mean doctors, hospital, urgent care, anything that has to do with your health. I've also been working for one of the biggest healthcare providers in the entire world for the last 7.5 years. Working for this healthcare provider, I've had an insight to see exactly how they manage their product. Healthcare suppliers are responsible partly for the cost of your healthcare. And the last point I'll make is know where your healthcare provider gets their supplies from before it's too late. According to the Chicago Tribune, people visit their doctor an average of 4 times a year. This is up 26% from 1996, and this was done in 2008. Americans go to the hospital altogether 1.1 billion visits a year. That's a ton. This means on average, Americans will go to a healthcare provider 280 times by the time they're 70. If you do the math, by the time we are 70, and with the growth of how much it went from 1996 to 2008, we'll go to the hospital doctors nearly 500 times. How am I a credible source? As I said, I've been working for one of the biggest healthcare providers, or one of the biggest healthcare suppliers since 2008. And this healthcare provider that I work for, or supplier that I work for, literally supplies everywhere, all the hospitals and doctor's office that you go to, minus like Ohio State, and there are some small ones, so it's important to know where your healthcare provider gets their health supplies. Started working for the company in 2008, and I've seen the growth in product care. When I first started there wasn't as big of an emphasis on cleanliness and expiring product, things like that. But over the past 7 years, it's grown a tremendous amount. And not a lot of companies are that way. There are a lot of companies that are not growing like the company I have worked for is. I started off as the last man to touch a product before it got into the truck and shipped to the hospital. Then I worked in a department where I was the first person to touch the product as it came out of the trucks before it went into the racks. And then now I manage all of the 30,000 locations in the warehouse that holds the medical supplies. So I'm in charge of making sure that hospitals get the correct product, or at least so the people shipping the product can pick it correctly and that it's not expired and that it's in manageable areas to be cleaned. Through many years with this company, I've had the opportunity to see exactly how the big suppliers treat their product and deliver these goods. Fortunately, the company I work for really cares about how well taken care of their product is. So anything from when you go to the doctor to a tongue suppressor to IVs to the liquid that they'll make you drink when you're pregnant. My company supplies all of that to the providers. And it's obviously a big deal that none of that's expired, dirty, anything like that. But like I said, you gotta know where you're getting it from. The number one goal for a healthcare supplier should be product efficiency. Product efficiency leads to safety, and the last thing that anyone needs when in their healthcare provider is the wrong product or product that is expired or is dirty. When I first started working where I'm at, and as probably many places still are now, dirty product was a big deal. And obviously when you're in the hospital and you're in surgery, you don't want them sticking something on you that's covered in dirt. It's pretty disgusting. If you're at the store, would you be comfortable grabbing a carton of eggs that was covered with dust? No, because it's unsanitary and you don't want to take the risk of getting sick. It's also disgusting. If you ordered a steak at a restaurant and you found out that the restaurant had left its meat out overnight, would you ever eat there again? Absolutely not, because you'd be at risk of getting all kinds of different diseases that are carried through that. These rules also apply to your healthcare provider and where they get their supply. Believe it or not, there are healthcare suppliers out there that bend the rules and do not abide by the regulations that the government sets for them. It's little things that matter. Next time you're at the doctor or hospital, check the dates of what you were given. Check the cleanliness. The last thing you want is to get sick from going to the actual doctor or hospital. You get what you pay for with your healthcare supplier. The supply chain is the second largest and fastest growing expense for healthcare providers, with only labor costing most providers more. So labor meaning doctors, nurses, things like that. Second thing that will raise your healthcare costs is actually the supplier. Many people really don't think about that. Where am I going to the doctor? If you check out where you're going to the hospital and know the supplier, it could in turn save you money. Because if you're going to a hospital that has a contract for millions and millions, well actually probably billions of dollars, there's a big chance that they are upping the price because of how much it costs. Hopefully you guys are convinced that you need to know where your health care provider gets their supplies. The majority of people have no idea where the providers get their product, and they are at the most risk. They're overpaying and have a higher risk of getting contaminated products such as unsterile and dirty items. Most of the time when people go to the doctor, they think that everything they're given is sterile. That is literally the most ridiculous thing you can do, because 95% of the things that you get are not sterile, and they're not written sterile on the actual product itself. You have a right to know where they get their medical products, just take advantage of it before it's too late. So if you get anything out of this, just remember that knowing where your healthcare provider gets their supplies is a big deal, because sterility, like I said, most people think that sterile products is just a given, and it's not. Like, there's been many times where I've had to pull product out of areas because they're dirty, and that's to make sure that your healthcare provider is not giving you dirty products. So check out where you're getting it. Check out, all this stuff is available online. It's a good idea just to do a little research before you take your kids and your family to a healthcare provider that's not sanitary or safe.